Hello, everybody. I am Laura Coleman, and I am super excited and elated to have our special guest here today. I am with the National Collaborative for Infants and Toddlers, and I am based in Baton Rouge, Louisiana. And I will let my special guest introduce herself.
Hi.
Hi.
I'm Shavon Arline Bradley. I'm the president and CEO of NCNW, the National Council of Negro Women.
Thank you so much for being here, Ms.
Thank
Shavon.
you.
Thank you for allowing us to be in this space and have this very important conversation about Black maternal health.
Yeah.
So with that being said, we're going to dive right into
Sure.
it. So let's pick your brain and see what you have for us today. So we're going to get into some root causes. So I want to know, what are the underlying issues that contribute to disparate outcomes Black mothers currently face?
Black women in this country are challenged really with access to healthcare because of a few issues. First and foremost, racism. Racism in healthcare and in the health field is really connected to how many providers assess and see their patients, particularly Black women. There's an assessment that we can handle pain more than others. There's an assessment about our backgrounds.
Yes.
And there are, unfortunately, there's evidence that shows that many providers look at Black women as not as their priorities. And so we see issues like, unfortunately, maternal mortality that has been running rampant in our community. I would also say issues around economics, our ability to have access to care.
Yeah.
But I want to offer this, that Black women, regardless of their socioeconomic status, still have the highest rates of maternal mortality in this country. So what's really interesting is that it doesn't matter where you live, doesn't matter your education, doesn't matter how much you make, as a Black woman, you are still at risk for dying from childcare, from health, from birth. I will say this. There's another piece that I really think is important to talk about, and that's, quite frankly, these larger, what we call social determinants of health. Now, in this world of concerns about these words,
Yes.
it doesn't change, right? Your background, your education, your geography, where you live, all of those things, your zip codes can affect the way that you receive health care.
Absolutely.
And so when you think about disparate race, disparities are really around gaps. And when those gaps are not closed, when those gaps are not accounted for, you will see the kinds of race that we're seeing in Black women. And unfortunately, our country has not grappled with the realities of what it means to be a Black female patient and to be a Black female patient attempting to give life.
Absolutely, absolutely. Thank you so much
Yeah.
for that. And I think this is a great opportunity to give my school, Meharry, a shout out, because I am a part of the inaugural cohort where we are talking about the social determinants of health and pursuing my PhD in global health equity. So I
know your dean. I'll be there. I know your dean. That's great.
Awesome. So I'm just super excited that you mentioned that,
Yeah.
because a lot of people stop at the forefront, and there's so many layers when it comes to the determinants of health. So absolutely. So I want to get into the NCNW's role.
Mhm.
What is the National Council of Negro Women doing to ensure the best outcomes for Black mothers and babies?
The approach to NCNW is really intentional. Direct service and direct action are our key priorities. Our organization is 90 years old. We have over 370 sections or chapters across the country. And we have 37 national affiliate organizations, which are the Divine Nine, the Faith Women, women in civic organizations. And our approach is really clear. Indirect service is our programming. We provide education and raise awareness to issues that are very specific to the needs of Black women. But in our direct service, we also have to activate direct action. And direct action, we quite frankly say it this way: we are advocating against systems that cause our people to have needs.
Love that.
So this idea of this revolving door of ensuring that we're giving education, we're educating mothers, we're educating providers. So amazing that we're working on connecting with Black female doctors to help us in this process. But then the direct action, which is this highlighting of ensuring that we deal with these legislative opportunities to advocate for Black women. The Omnibus Bill is one of them that we were on the forefront for. Thinking about activating healthcare and access to care, the Affordable Care Act. These are ways that we're able to identify our work. And because we have advocates, because we have, from collegiate students all the way up to our seasoned women, we have a cadre of thousands of women, and in some cases, a reach of 2 million women that can respond to these issues. And that makes us an organization to be reckoned with in this space.
Absolutely, absolutely. You touched on a lot of what the organization is doing, but beyond personal advocacy, what systemic shifts are most urgent to truly protect Black mothers and birthing people?
Yeah, I think it's the medical community first. We look at the healthcare sector first. There has been a massive rollback of some commitments in medical school education. But this starts with providers and patients being on the same page. When you look at the way that providers are trained, what we're finding is that these cultural nuances, not just competency, but nuances and cultural engagement and understanding Black women as patients, we've got to hone in on one, increasing the number of African American women who are doctors, who are providers, African American men, and for persons who are not African American, giving them the context to understand what are some of the issues that Black women are facing. I think the other thing in terms of systems work is really around legislative practice. How do we identify those policies that not only change institutions, but will change the law? Right? What's against the law? And as you think about, I think about some of the issues that have been happening, particularly in the Deep South, where we've seen a mother whose body was kept alive to protect a fetus. It's really difficult for me. I was someone who lost 3 children. And so this idea of maternal health is so intentional for me because my first miscarriage, I almost lost my life. And so as we think about systemic areas, I had a doctor walk past me. Well, he wasn't trained to deal with an African-American woman who had degrees and had the ability to navigate. I think the systems navigation is also centered around how we train Black women to fight for themselves. I knew enough to call the person that was leaving the hospital. I knew enough to be able to use my contacts to go above the person that was dealing with me. That's a systems issue.
It is.
And so I am encouraged that Black women are more aware. I'm encouraged that we have a Congress that has Black women with the Congressional Black Caucus that have committed to this. But I will say, as a woman who has dealt with this, who has seen the experience of what it means to be a patient on this side of the experience of a provider, I want to tell you that it's really about giving Black women the agency to be able to advocate for themselves. So it is systemic, but it is also the way that individuals address systems in their pursuit. The hospitals can't change unless the patients say it. The legislation can't change unless the voters say it. So it's all connected.
Yeah. And I love that you talked about the agency. We'll get ready to wrap up.
Sure.
Thank you so much for this. Is one piece of advice, one of the things that the National Collaborative for Infants and Toddlers is doing is we're focusing on 5 states, but those 5 states are in conservative jurisdictions. And so what I don't want is to single out other jurisdictions, but I want to know what piece of advice could you give to advocates that are working in these very red states, very far right? What piece of advice could you give them to continue the fight for advocacy for maternal health, specifically Black maternal health?
Yeah, you know what? It's so interesting. I'm a minister, right? And so part of my context is many people are activating from a space of a moral context. And there's an assumption that, and I'll say it this way, there's an assumption that if you believe that a woman should have agency, that you don't want them to protect, life. And that's not it at all.
Right.
This is actually about, my advice really is about talking about the full experience of a woman's journey to decide to create life. And the journey to be able to have life and have life in its fullest sense. And my advice is for those that are in spaces and states that may not be receptive, use the moral concept and context back. If you believe in life, if you believe in caring for those that are most vulnerable, if this is a religious context for you, that is what the good books talks about. It talks about the ways that we care for the poor, we feed the hungry, we care for the widow and the children. And I always say, if the loss of life is important to you, which life are you speaking of? And I think that it's important for us to be very, very clear that if you believe in divine thinking, all life is valuable.
Absolutely.
And that is my intention, is to help people understand that you can advocate. You may not even agree on the nuances of the morality, quote unquote, but you have to agree that life is valuable. You have to agree that children are precious, that mothers that have these children are precious, no matter where they come from, no matter the experience. And if you are who you say you are, that should drive you. And I tell advocates, use that. Use that language. Talk about the costs when we don't do this right. The financial costs and also the social costs. And so I think we're in a time where the country's all over the place. But I think the hearts of people are actually really well intended. They just need some guidance.
And with that, that is something so strong and so special. Thank you, Ms. Shavon, for
Thank
giving us
you.
the opportunity just to take some few minutes of your time today and get some nuggets about Black maternal health. And we hope that this is not the last time that we see you.
Absolutely.
Thank you.
Thank you.
Thank you.